Hi, I'm Dr. Sarah Hurvitz from the University of California, Los Angeles. When women take endocrine therapy or anti-hormonal therapy for a history of breast cancer, there are a number of side effects that they may experience. One of these that's rather difficult to talk about for some patients, but is very difficult to endure, is vaginal dryness and pain with sexual intercourse, as well as urinary tract infections, all related to vaginal dryness and atrophy of the vaginal lining or epithelium. This is a common side effect associated with drugs like aromatase inhibitors. Aromatase inhibitors include letrozole, exemestane, and anastrozole. These lower estrogen levels in women who do not have functioning ovaries, so it plummets the amount of estrogen in a patient's body, a woman's body, below the levels normally seen in menopause. Other drugs like tamoxifen can also cause some level of vaginal dryness or atrophy, leading to painful intercourse and urinary infections. So, a number of studies have been done looking at ways to mitigate this side effect. Typically, in a woman who's on anti-estrogen therapy, we don't want to use topical estrogen because it is systemically absorbed. It can go into the woman's blood and actually raise estrogen levels, which is something we don't want to do for a patient who's been diagnosed with ER-positive breast cancer. So our first attempt to address this symptom is to utilize vaginal moisturizers or vaginal lubricants. There's a variety of over-the-counter moisturizers and lubricants available, some with names like Yes, Luvina, Replens, KY. Those are just some of the brands out there that patients will try. I recommend that patients use a moisturizer several times a day and lubrication before, during, and after intercourse to help with the pain associated with dryness. On some occasions, patients have tried procedures. For example, there's a procedure called Mona Lisa, which is a laser therapy that gynecologists can administer. There have been no clinical trials, randomized clinical trials, showing whether or not this truly benefits a woman with vaginal atrophy. Anecdotally, some patients have found that this is beneficial, but I haven't seen it covered by insurance thus far. And so whether or not it really is worth the money is unclear to me. Some patients who have recurrent infections or develop serious side effects such as lichen sclerosis, which can cause a very painful situation in the vaginal area, have turned to topical estrogen based therapy. And this I recommend using with caution, but on occasion, patients do need to turn to that. And what I recommend is they use the least amount possible to obtain the desired clinical outcome. And I work closely with my colleagues in gynecology to try and achieve an ideal outcome for those patients in whom lubricants and moisturizers are not effective.